And to one of your points, which is very poignant, you said there's a ticking time bomb for those who've taken the vaccine. What does that mean? You mentioned turbo cancer. Can you explain that for us?
Yeah, and listen, I don't want to scare people unnecessarily, so I would say potential. You know, there's a big unknown here as well, Michal, because, for example, I thought I had escaped any major vaccine injury, to be honest. And then I got diagnosed formally with a vaccine injury, 2 years after having had the COVID vaccine. So there are things that, we need to be able to help and identify people without scaring them to make sure that cardiovascular risk for me as a cardiologist is of great concern. What the COVID vaccine seems to do from good quality data, backed up with, plausible mechanism and real world data as well, plus the randomized control trials from Pfizer and Moderna, it seems to accelerate heart disease. So there are people who may have a bit of mild furring that may not cause them a problem in terms of having a heart event or a heart attack, maybe for 15 or 20 years. And what may be happening now is that suddenly within 6 months, a year or 2 years, they're suddenly presenting with a heart problem, which was likely precipitated by the COVID vaccine. So there's a big area of unknown, but there are things we do know. And that is my biggest concern, is there are people walking around right now that can be helped and identified if there is a big moratorium